Today, our video is regarding Lamisil tablets, which is highly effective in treating fungal infections of the skin, hair, and nails. In today's video, we will let you know conditions under which Lamisil tablet is used, its dose, how to use, special precaution related to fungal infection, and its common side effects. Lamisil tablets contains terbinafine, which kills the fungus or stops it from growing, and is used for the treatment of fungal infections including the groin area or jock itch, which affects the private areas, for fungal skin infection, including ringworms and yeast infection, toe and fingernails infection, which are yellow, opaque, and thickened nails, athlete's foot. Let's see the dose and how to use Lamisil tablets in different conditions. For nail infection, which are hard to go, the dose is 1 tablet daily. Treatment duration is from 6 weeks to 3 months, according to your doctor advice. For toenail infections, where fungus grows on or under your nail, the treatment may need to be continued for 6 months or longer. For all other skin infection including jock itch, athlete's foot, ringworm, and yeast infections, the dose is 1 tablet daily. Continue taking the tablets for 2 to 6 weeks. For children weighing 20 to 40 kilograms, the dose would be half of a tablet once daily. Swallow the tablets whole with a glass of water. Lamisil can be taken with or without food. Fungal infection can return back easily, so special instructions you need to follow are: keep the infected area dry and cool, as moisture and sweat can regrow the fungus. And also change clothing that is in direct contact with the infected area daily. Avoid wearing tight clothes, underwear, stockings, and synthetic clothes. Wear cotton clothes if possible. Some of the side effects which you may experience after using this tablet are diarrhea, itching, rash, swelling, pain in the muscles and joints, headache, loss of appetite and indigestion. Also note to store the medicine below 25 degrees centigrade and don't refrigerate.